Hey Ivy, my name's Quentin. I'm a figure student nurse today. The doctor here has a couple orders put in. So first off, I'm gonna start doing I have a Foley catheter that I have to insert. Have you ever had one of those before?
I don't think so.
Alright. Can I also have you confirm your last name and date of birth for me?
Ivy Armstrong, 3964.
Alright. Are you allergic to anything?
Just latex.
Latex, perfect. Okay. So this Foley catheter will be inserted through your urethra, and then that goes all the way up to your bladder, and then that helps measure your input-output for urine in case you're having any issues with that. It also just helps if you have to go to the bathroom, you don't have to get up or anything. You can just go ahead and go. So it'll make it a lot easier for your stay here. All right. So I'm gonna raise your bed up here. I'm gonna go ahead and grab all my supplies here. I did wipe everything down before also. Alright, so I'm gonna bring this blanket down. It's okay if I expose you for a bit?
Yeah, that's fine.
Alright, so we're just gonna, I'll try to make it as fast as I can. We're just gonna have to expose you for a sec. And I'll just put this down. Okay, go ahead and lift this up, okay? And then I'm gonna have you move your legs up here. I'll help you here. Okay. Also, this leg here. Out. Awesome, perfect. Bring it up a little bit higher. Alright. I'm gonna get all my equipment set up, ready. My little trash can. Alright. So I'm just gonna go ahead and get you a little re-cleaning here. Just gonna wipe that down. Perfect. Okay. Now I'm gonna go ahead and just change my gloves to make sure everything's as sterile as possible. Alright. Alright, so now I'm gonna take this, pinch this backside, pull towards me here, and pinch this side, and pull it away. Pinch this side, and pull out, pinch and pull away. I'm gonna sit here and kind of rotate this using the outsides here, outside hinge. Go ahead and use that. Now, not touching anything else. I'm just gonna go ahead and finish up this padding. Hinge here. Again, using the outside out, the corners here. Go ahead. Drape this. And just touching the outside edges. I do already have sterile gloves, so I'm just gonna move these out of the way. Okay. Again, just pinching, make sure not I'm touching anything else. Fold these out from the corners. Fold it out from the corner. Shiny side down. Again, just making sure everything's sterile. I'm not gonna touch that yet. Just that outside edge there. It's on top of the other. Perfect. Alright, so now I'm gonna go ahead and change to my sterile gloves. Bone here.
Shut up.
And then For me personally, I sweat a lot, so I would go wash my hands and do the proper hand hygiene for 20 seconds. This is me using a towel to dry. Perfect. Okay. Alright, and this surface was also wiped down before, so it is clean. Fold up. Fold out. And then we're gonna doors. And back right here. Straighten it out the best I can. Okay. Now, putting my dominant hand on first, I'm grabbing the inside of the glove. Comes out. Make sure it moves up. Get my pinky in. Still touching the inside. Let's just grab the inside here too. First one on. Grab the outside. All sterile right now. Okay. Stay on the outside. Keep it sterile.
Sorry, your kit was pretty tore up. Looked like that tornado that hit Barnacle. Oh, thanks.
Turn this around using all the sterile parts. Keep it away from my body. It'll take longer to put the catheter in. So all the outside. Not touch anything else. Hands are less sweaty. Okay. Alright. I'm going to be keeping these above my waist. Not touching anything else to be certain. Alright. So, I take this. Since this was in the sterile field, I'll be using my sterile gloves. Put this all over. This is the iodine. You'll let that soak. These soak. Get these little areas here. Okay. Next, going to the syringe here. Going to put this onto the loop. I'd toss this, but saving it for practice purposes later. Go ahead and just press that together. Okay. Next, I'm going to take my lubricant here. I would squirt this all here on the inside. And toss it again. Perfect. And I'm going to grab this here using the sterile gloves. Just bring it a little closer for me. Right. And then I'm going to go ahead and clean first, and then I'll get this lubricated, and then I'll have the brake sterile to lubricate. We're gonna go ahead and get this clean first. So, open it up here. I'm gonna take this iodine, go in, trash. And this one. Right down here. Trash that. I got one more. Perfect. And then also trash that. Perfect. Okay. Now I'm gonna have the brake steel field lubricate the catheter here, so I'll bring this out. And catheter solution. Thank you.
Patients are like, I want the attenuate. That's not gonna happen.
Let's get this out the way. That'll be in the trash. Okay. Alright, so thank you, appreciate it. Then we're gonna go. Okay, so now we're gonna go back into the sterile field. Separate. Out. Just kind of insert. Ooh. Dropped into the sterile field, so we're good. Just keep sliding gently. Just a little bit more. Alright. Now I'm good to break sterile field because it is fully inserted. So what we're going to do now, get this a little untangled. I'm going to now inflate the balloon. Make sure this is fully on. Alright. Go ahead.
Under the supervision of
Remove. This is all good now. All can be trashed. Okay. Now I get that insert. Give it a little tug just to make sure all's good there. Okay. I'm gonna have this hooked on the side, and I'll strap this leg. I'm gonna hook this on the little hook out here. Perfect. And strap over here.
There was like 100 people in there. I was thinking maybe like not.
Here's a sterile procedure.
Bring this over. Alright, just gonna wrap this around your leg here, Ivy.
And then my friend, she was going
Velcro, that's too tight. That's that good?
No, it feels good.
Alright. We're gonna get this strapped in too. Get that nice and tight so it doesn't move. You can see you can have a little bit of room so in case the patient decides to move. Perfect, so you're okay to move, and if you ever need to go to the bathroom, you're good to go. Alright, so I'll get everything out the way. Dispose of everything here. To the side. This. Hold this all in together. Hold it all in. Move this. And I'll cover you up a bit. There you go. I'll get you situated, and then we're gonna go ahead and get an IV in here. That way we can give you some medication to help help pass urine. Okay. Let's trash out the way. Put all this in the trash can here. Alright, I'm gonna toss my gloves. Alright, I'm gonna hand hygiene. Get some of these trash out of the way, and I'll hand hygiene again as well. Go ahead and get some of this out the way. Alright, we're gonna hand hygiene one more time here. Gloves on, we'll get you situated, we'll get you comfortable. Now I'll go ahead and get get that IV in.
What else do you have to do?
So we gotta go ahead and put some IVs in. So this IV can help give you fluids if it's ordered, or any medications, which your doctor does have one medication to order at the moment. It is furosemide, I believe. I'll double check that order just to make sure. And this is a diuretic. So a diuretic will help you go to the bathroom or help you pee. and help get some of that fluid out of your body. All right. So I'm gonna lower you down just a bit, and I'll also get you situated. Go ahead and straighten your leg out. Straighten this one out. Let me get this a little bit more comfortable for you. Get your blanket back up.
Okay, like you.
There you go. Is that a little bit better?
Yeah, that's better.
All right, we're gonna come on this side now. EIV. All right, so we're gonna bring everything over here. Get this all set up. And once we're gonna bring this down. Just gonna adjust your arm a bit. Flush. I'm gonna leave my needle over here for now. I'll get everything prepped. I'm gonna have to tie this around your arm. It's gonna be a little tight. That's just gonna help me find a vein here. Some tape going. Alright, tape's going. There we go. And my J loop here. Open up. My flush. Pull back a bit. A little bit going there. I'm going to go ahead and attach the loop. And press down. Rotate. And we're going to prep the loop as well. Wiggle that off. And this little sterile area. Just gonna press that up. A little fluid going. Okay. Put this back on lightly here. There we go. Okay, I'm gonna set this right here to the side. For cleaning. J-loop. Alright, we're gonna get this tied now. Is there any reason I couldn't use this arm? Any surgeries, lymph node removals?
Nothing I can think of.
Nothing you can think of. All right, perfect. I'm just gonna lift your arm up here and get this under. All right. Alright, found a good vein here. I'm gonna relax that. I got the J-loop prepped. Bring my needle over here. It is capped. We'll uncap it here to make sure it's okay. We're gonna crack this and crack. It's gonna go up and down, side to side. 30 seconds to a minute, preferably a minute, just to make sure we get everything here. Alright, we're gonna let that dry. Flip it upside down in case I gotta use it again. Set this a little bit more to the side. I'm gonna check my catheter and make sure everything's okay with that. Okay. Catheter looks good, needle looks good. Okay, so we're just gonna lightly recap here. Alright, I'll let that dry a little bit more. I'm gonna tie this tight again. Uncap the needle here. Anchor the vein. Alright, a little poke here. a bit. We're gonna get this going. I got the catheter forward. I'll click the button, and then I'm gonna pinch this a bit. I'm gonna set this here for a second. I'll put that right in the sharps as soon as I get a hand. We're gonna go ahead and pop the loop here. I'm gonna get this tied. All right, we got that tied. I'm gonna get this taped, secure it, pop tourniquet. Tape just secure it for a moment. Perfect. All right, I also grab some gauze real quick. I'm gonna put this in the sharps right away. Okay. These gauze get you cleaned up a bit. All right. We're gonna go ahead and get this all secured. There. So one thing I don't have in my kit, so I'll be right back. 1 sec. I got this secured with some tape. My IV kit didn't have one of the things it needed. I'll be right back. Give me 1 sec. I'm gonna drop your bed and put this right back up. All right. Is that hurting you at all, or any pain?
No, nothing like that.
Nope. Okay. I'm gonna get this flushed real quick. Go back. All right. Got good blood flow. So we're gonna push that forward. And push this off real quick. As I'm pushing forward to get that positive pressure. Okay. I will be right back. We're gonna go get some couple supplies. I'll get this out of your area. Get you lowered down real quick. Alright. I'm gonna toss my gloves here. Foam. All right, IVM right back here. We'll get this secured real quick. I'm gonna foam in again, and then I'll grab some gloves. I'm too short for that. Or a flip. All right, we're gonna get this secured here, and then right after I'll get you your medication, and hopefully I'll leave you alone for a bit. Get that through. Same time. All right, we're gonna raise your bed back up. Give me a comfortable little work spot. All right, perfect. I'm gonna lower this back down. We're gonna lift your arm up for a sec. I'm just gonna get this out of the way. Okay. We got that. And bring this over here. Right. Alright, so this is just a little sticky pad here, and this goes right to cover this IV site. Kind of give you some support here. This way it keeps everything together, keeps the catheter in. Okay, so that's secured. I'm gonna go ahead take my tape off. Get my tape here. This is for to help secure everything. Go ahead and see if I can get this off. Here we go. Okay. I'm gonna get this dated, time and dated. In case we gotta give you another IV and make sure it goes bad. Trash that. Still not hurting you enough? All good?
Oh, so far
Okay,
so good.
perfect. So we're gonna get this here. Okay, I'm gonna take this tape off. We're gonna go ahead. I'm gonna prep your medication real quick before I fully secure this. So I'm just gonna leave this on here. That's all sterile and clean. So we're gonna go ahead and prep your medication. Okay, more trash. Trash into this. All right. So I did my first check of the Pyxis. I have an order for 20 milligrams of furosemide, which is 1 mil is 10 grams, so I'm gonna do 2 milliliters. So that's my second check also. I'm gonna get this going. Here's my medication. Furosemide, 10 milligrams per milliliter, perfect. Let me get this clean here. I'm gonna do 30 seconds. 8, 9, 30. Just gonna go ahead and leave that gauze on. Get the I'm getting contaminated. Okay. All right. So this is a multi-use medication, so I will be putting air into it. It's good here. Okay, we're gonna take this off. Okay. We got 2 mils here. That's where 2 mil mark is. We're gonna pull back. 2 mils there. Perfect. I'm gonna take this off. I'm gonna be putting that into the air here. Okay. That bubble is just from multiple uses. Alright, we're gonna go ahead and flip. Make sure it's in the medication. Alright, so back. Do 2 mils. Perfect. We can get the air out. Alright, I'll go ahead and cap this. Capped it. Okay. Make sure all the air is out. Part of that's from just the multiple usage leakage. Alright. Perfect. So now I'm going to over here. Grab an alcohol wipe just in case I might drop this little loop. Alright, and we're gonna toss this into the bio, or not bio, the sharps. Perfect. Alright, Ivy, I have a total of 20 milligrams of furosemide, which is a total of 2 milliliters because it's 10 grams per milliliter. And can I have you confirm your name and date of birth for me?
Ivy Armstrong, 3964.
Alright, and still allergic, just latex?
Just latex.
Just latex, perfect. Okay. I'm going to go ahead and I will sterilize this because of so I'm going to let that drop. So I'm going to go ahead and move this over. So I will be sterilizing this. 30 seconds also. Okay. Rub it pretty strong, pretty good. 30 seconds, perfect. All right, so make sure it doesn't touch. All right, I'm just gonna go ahead and push this in. All right, so I have to do this over a minute here. Just gonna push 2 mils. And make sure it's unclamped. Over 1 minute. Okay, perfect. So I got that. And because I did set down my flush, I would grab another flush. So this is gonna be my new flush here. Again, pull back, make sure there's no air. Go up, perfect. And since I didn't set that down, this is still sterile. Put this in. All right, and I would do the same. I would end up flushing this for a full minute as well. And by the time I get to that full minute, we're gonna have to positive pressure this. Just gonna keep the flow going. And then maybe. We'll get it. There we go. All right, we're gonna keep the pressure going, keep it pushing, and it's clamped. So now I have that positive pressure. Okay. That will be trash. Just gonna trash these items as well. Get this out your bed. And then also I would cap this as well. And then fold it out here. Gonna keep it away from being pulled, and this is the tape we're gonna secure it with. All right, all secured. Does there have any pain or swelling in here? All feels good?
Nope, it feels pretty good.
All feels pretty good. All right, let me make sure I get all your trash out of here. That looks clean. Catherine feels okay. Everything feels great.
Everything feels good.
That is perfect. All right, so clean up my whole mess. Let me pick this up. Clean up all my trash here. So this. I would toss this. This goes here. Just because this was medication, could be a biohazard, I will put this one in the biohazard. All right. Is there anything else I can do for you?
I think I'm okay right now.
Okay, all right, we're gonna push your bed down here. All right, you should expect that direct work pretty quickly, so I'll be back in about 15 to 30 minutes just to check in on the urine output, okay?
Alrighty, sounds good. Thank you.
I'm gonna toss my gloves here, and then foam out. All right, you have a good one.